Thank you, Kathy. Pathfinder International is pleased, and I am indeed honored to join Ms. Magazine and the Feminist Majority Foundation in recognizing two extraordinary and remarkable people and the work that they have done, not just in their countries, but as people who have spoken out clearly and forcefully on important issues that affect the lives of some of the most vulnerable people in the world. I thank Dr. Orero and Nafis Sadik. Dr. Solomon Orero is an outspoken advocate and dedicated physician who has seen firsthand the devastating effects of unsafe abortion and has worked with Pathfinder's office in Kenya as a senior advisor for our work in East Africa. He speaks with a clear and steady voice and with conviction and with compassion about the needs of women in his country. Dr. Sadik and I have known each other for an even longer time, and her voice has been a major and significant one on behalf of women worldwide in her role as the head of the UNFPA and since. She has been on the board of directors of Pathfinder for almost 9 years. She speaks with power and passion. She indeed is an elegant and an eloquent voice in this movement. Both are extraordinary individuals, and each has made a tremendous contribution to advancing the rights of women and girls, and I am proud to be here and to congratulate them. Pathfinder International and its founder before it have been at the business of international family planning for 80 years or so, since the late 1920s, when the founder of Pathfinder first started work in family planning. It was incorporated almost 30 years later, so for 50 years, and under its current name and as an incorporated entity in the U.S., it has worked around the world in more than 100 countries during that time, providing family planning services, speaking on behalf of some of the world's most vulnerable people in order that they obtain and have access to reproductive health care. We believe that reproductive health care is a basic human right. Pathfinder believes that while all women should have access to safe abortion, it is also important and critical that they have access to family planning services because they are the essential first element in delivering reproductive health care to women who are the most vulnerable in the world's poorest countries. As an organization that receives U.S. funding for its work and has for several decades, we have seen firsthand the impact of harmful U.S. policies like the global gag rule, as well as the effects of decreased funding in international family planning programs over these decades. As a recipient of U.S. funds, we have made our position on the critical issues very clear to the public and therefore to the Congress, because our conscience requires us to do so. U.S. family planning assistance is one of the most successful interventions in the history of the U.S. foreign aid program. Yet funding for international family planning from the U.S. has declined in real dollars by about 40% in the last decade, while today more than half of the world's population will soon or is already approaching their reproductive years. The need is great, and the stakes are very high. Worldwide, almost 200 million women want contraceptives, modern methods of birth control, but have no access to them. Indeed, Kenya, about which we will hear in a few moments, is a perfect example. With the assistance from the donor community, including but not limited to the U.S. government, Kenya reduced its fertility rate dramatically for several years, one of the fastest, perhaps the fastest, decline in fertility rates ever recorded since the history of family planning. And yet that has now plateaued and for a few years has now begun to reverse itself. The average number of children in Kenya per woman was at one point more than 8 children on average per woman. It had declined by the mid-1990s, it had declined to 4.5. It had made a steep decline, and that's been now leveled off, as I said, and going in the other direction. The need is enormous, and the task is a big one. The U.S. must not only continue its support, it must increase that support at the risk of turning back the clock. You'll hear now from the distinguished guests who I've mentioned earlier and saluted. First, it is my pleasure to introduce to you Dr. Salam Orero, who has done extraordinary work in Kenya that I want you to hear about.